Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinologist based out of Oklahoma City. Today, I have a returning podcast guest. His name is Johnny Hadac. I had him on last year, but now he is Dr. Johnny Hadac. So he came as a medical student to see Modern Endocrine in October of 2024. He did a rotation with us. I kind of think it changed his life. He is a wonderful human being and is very interested in functional medicine. And I introduced him to the world of gut. And so I wanted to bring him back because now he's been a resident for 5 months. I wanted to ask him, how is residency going? Is it everything that you expected? Just kind of talk about some of the lack of education and just some things in residency, just to kind of let you guys know what is training like in the United States. Now, fortunately, he got a really good residency program. And so his residency is not maybe representative of all residency programs, but I wanted him to answer just some general questions about his training, his education, how he felt. I also wanted to talk to Johnny about just, kind of what he's been doing as far as nutrition. He came out with a new cookbook, y'all. This is his version 2 of his cookbook. Phenomenal cookbook. He has 100 pages in the front where he literally just teaches people stuff, and he does such a good job of breaking things down for you. He has a whole section on gut health, which really makes me happy, like everything that we talked about at Modern Endocrine. And so I just wanted to pick his brain about how has life been for the last year. A lot of you loved him and follow him. What is going on? What do you see as issues in healthcare and healthcare reform? What do you see as issues as you finish training and become a doctor? So that's kind of what we talked about. Dr. Johnny Hadac is a family medicine resident physician, certified nutritionist, and culinary medicine specialist who's changing how people think about health, nutrition, and disease prevention. As the founder of Total Weight Loss and Muscle Dummies, he's built a global community of over 2 million dedicated to taking control of their health through affordable, science-based nutrition and lifestyle habits, which is so monumental. He's got a best-selling cookbook. So he's a best-selling cookbook author and app developer. He combines medical expertise with everyday practicality to help people eat better, feel better, and perform better. His Total Weight Loss cookbook and Total Weight Loss app, which the app is coming out, should be out by the time this podcast comes out, provide hundreds of affordable, high-protein, high-fiber recipes designed to optimize hormones, balance blood sugar, and restore metabolic health, all while making healthy eating simple, realistic, and sustainable. I am so happy to call him a friend, a colleague now, and I'm super thrilled to see what this young man is going to do in the world. So let's talk about everything he's learned over the last year and all the healthcare disparities and issues that he sees with medical education. So I have a special guest back this week, Johnny Hadac. I had him on the podcast last year. I think it was in October. He came and did some time at Modern Endocrine. He was in med school, and so came and we kind of taught him about the gut. He left and went away into the world, is doing amazing things. He's in residency now. But I wanted to bring him back for a couple of reasons. Number one, he dropped a new cookbook that you guys all need to get because he did a bunch of education in the beginning of it. We're going to talk about that. Number two, I wanted to talk to him, if you guys recall the episode we did, about just what he's experienced as far as traditional medical training, right? So he's been in residency for about 5 months now. So I want to get his thoughts on what did you think residency was going to be like and how is it? And then just kind of catch up with him, talk about nutrition, and he's in a lifestyle medicine program. And so we were just talking about accreditation and some stuff like that. So thanks for coming on.
Super pumped to be back. And guys listening at home, happy to be back.
Yeah, we missed Johnny. He came for a while, for a month, and then kind of left. But how is it going? So when you left, I know you finished your rotations. You're in your last year of medical school. You had lots of rotations you did in different places. Originally, you were based out of New York, but you've ended up in Florida. Lots of exciting things have happened to you. You've ended up in Florida, got married, lots of good stuff. So how has life been for the last year?
It's definitely been a roller coaster, and probably in all the best ways. I managed to do a family medicine program down here in Bradenton, Florida, just south of Tampa. And it's an amazing residency program. I have some amazing co-residents. My program director is absolutely amazing. It's a very small program, which I really do enjoy. Small little community hospital, so it's very one-on-one with the training. And honestly, I love being down here in Florida. I remember last time I was up in Oklahoma City, you and I would always go on these walks during lunchtime and get some sunlight on our skin. And that was another big thing. Like, I did not want to go to a program that didn't have any sunlight. So being down here in Florida with the sun every day, it's just like the best thing ever. I love it down here. And honestly, I've been loving residency.
That's way different than New York, I'm assuming. So maybe they'll make a Floridian out of you. But when you left Modern Endocrine last year, tell people, like, was there anything in particular you took away? Like, hey, I really want to make sure I incorporate this whenever I, practice medicine or go into training. Let's start with that.
Yeah, I mean, there's so many different things. Because when I initially came to you, in regards to functional medicine, it was something that I was never taught and I never had any experience in it. So there was definitely a few things. Number one, gut health. That was something that I really walked away. I ran away with gut health. I absolutely just thought it was the most important thing missing in people's diet, missing in people's lifestyle. Number two, hormone stuff. I mean, I remember you let me do a pellet on a patient, which was awesome. And then just recently, all this brand new estrogen for women in menopause and being able to use that, that's been absolutely amazing too. So I've been learning a lot about that. But really the functional side of things and the gut health, I have to say, is probably the biggest thing, and just the incorporation of fiber and different foods. You guys know I'm very much into nutrition, and that was something that I really incorporated to a lot of my teaching for my patients and a lot of research that I have done on the back end throughout medical school and even into residency. That's really allowed me to kind of stand out versus any other resident and any other doctor in this field.
Yeah, so I think those are two, like, of the things that I, stand and scream to the mountains about. I actually just had a podcast that released last week that talked about this. Number one, what you said is hormones, right? So it's just a very underutilized tool and something that is essential for health. And I'm so glad that the black box warning came off of estrogen last month. But now we've got to get the fear out of people, get the fear out of providers, and then educate people on the importance of testosterone in women. And so that is one thing that I'm very passionate about. And the second thing is gut health, because you're never going to fix chronic disease and get away from chronic disease until you fix someone's gut. So I'm really glad that you got that out of the month that you had with us, and that you've incorporated that into your cookbook. Even you have a whole gut health section, you have a probiotic now that has great strains in it. So I love that you got that, because it's really hard. And I'm curious to know, from your perspective, you've worked with clients for a while. Have you noticed any difference in working with people as far as blood sugar control, weight loss, when you have addressed their gut versus not addressing it from a lifestyle perspective?
100%. I mean, inflammation is the root cause of all disease. And it's amazing once you start focusing on fixing people's gut health, how much less inflamed they feel, whether it's their joints, whether it's their brain fog, whether it's their skin. There's so many things that really open up when you start focusing on the little details in regards to getting your fiber, fermented foods, getting polyphenols in your diet, all these different things. And they're honestly very easy to fix. I mean, when I teach my patients about getting 30 grams of fiber, eating a side salad with dinner every night, adding berries, eating avocados, eating their fruits and vegetables, these things are very easy. And people have better results at the end of the day. I mean, if your gut is more healed, you're better able to absorb those nutrients and actually have your body use it for the most good. Additionally, with 70% of your immune system being in your gut, 90% of your total body serotonin, I mean, there's so many different studies in regards to leaky gut and its effects on mood and its effects on autoimmune conditions, so many different things. And incorporating gut health has been one of the most important things with all of my patients, and it's really paid off.
Awesome. No, I would completely agree. And you do a lot of really good educational content, not only on social media, but I'm sure with patients in your residency program. And so really teaching them about the gut is so beneficial. And we were kind of talking about before this, you are also doing this lifestyle medicine accreditation while you're in residency. So tell people a little bit about that. Like, what is it? And then we were kind of talking about maybe there needs to be a gut health accreditation program.
Yeah. So, I mean, lifestyle medicine, it sounds very good to be a lifestyle medicine board accredited physician. And I wasn't really sure what I was getting into. It's something that's kind of new in residency market. There's a lot of programs that are picking up the lifestyle medicine accreditation. which I think is great. I really do think it is good. I think it allows young physicians to learn more about holistic health, how to take care of your mental health, your physical health. But anytime that any accreditation or any doctor has very constrained kind of thoughts and views on diet, it always piques my interest. And this program specifically is one that really pushes the plant-based diet. And if you guys know me and you guys know my content, I'm all about affordability, I'm all about accessibility, and I'm all about whole foods. And I'm a high fiber, high protein, low carb kind of guy. I think if you stick to that diet, I think people have the best results when it comes to weight loss, when it comes to blood sugar, when it comes to all these chronic conditions that we see in the family medicine side of things. And there's this big push for plant-based stuff. And for me, I'm someone, again, I'm really into fiber. I think every human should at least be aiming for about 30 grams of fiber a day, getting your berries, your avocados, your side salads, your fruits, your veggies, all of that. But in regards to pushing an agenda where you're cutting out certain foods, you're cutting out certain macros, I'm never going to align with it. And I'm coming from someone who has done carnivore, who has cut out all plants in my diet before. And then I've also been doing a lot of research on just strictly plant-based diets. I've been reading a lot of research, reading a lot of books, and we ran into something where my content has a big reach, and there's been a lot of people who see my content, and there were some people of that accreditation who thought I was pushing more of a carnivore-esque kind of program on people, but it's very apparent when I watch my content that it's not that. Um,
Yeah.
but it's just interesting because for me, having ability to eat plants and meats and anything that's accessible, that's going to be most important, especially when in the world of nutrition, there's levels to it. There's levels of, maybe someone really doesn't have any money. They only can shop at Dollar General. They can only access these foods. And then maybe, you incorporate more protein, more fiber into their diet, and then you start working on better ingredients. You start cutting out things like linoleic acid, some seed oils. I'm someone that's pretty passionate about that as well. But there are levels to diet, and for them to kind of give me a little pushback into pushing into people to just do plant-based, it's like the accessibility of that is just about zero for a lot of people. There's a lot of people who don't have access to fresh produce. And then also, it's like humans are omnivores. I believe that we should be eating meats. I believe that we should be eating plants and fruits and keeping a
Mhm.
well-balanced diet. So it's definitely been interesting kind of leading the way in the nutrition space for young doctors, and also having big medicine kind of push back a little bit. I never really would have expected it, but here we are.
I told you last year, Johnny, this would happen, but you were this sweet, innocent medical student who didn't believe me, maybe. But you're seeing it now, right? So you're seeing that there is this problem with education in this country. And although we should be educated, to your point, what you're preaching, right? You need fiber, you need protein, you need fats, you need less carbs. Certain people might not like that and then want to change agendas and push more of this plant-based diet when it is clear in medical literature and just if you read the Bible that we are omnivores, like you pointed out, right? Like we eat meat, we eat vegetables, we eat fruit. And so it's interesting. It's also frustrating that that happens. So this lifestyle medicine accreditation program that you are a part of basically wanted you to change what you were saying just because they were afraid that you would target too many people on social media and get them to believe that not just eating plants was good, basically.
Yeah, and well, here's the thing though. It's like I do all this social media, and yes, I reach a lot of people, but I also reach a lot of healthcare professionals. But
Hmm.
you have to understand that healthcare professionals are a very weak link in this education gap. And there's a lot of
Hmm.
people who go to the doctor to go discuss diet. They go discuss weight loss. And us as doctors, I tell you what, we're good at. We're good at learning pharmacology. We're good at learning about different medications that can help people lose weight. And we understand the entire portion of what the medication does, where it acts, the mechanism of action, the class, all the side effects, all of these things. But when it comes to the education side of things, I mean, Harvard released a study showing that medical students receive less than 24 hours of nutrition education throughout their entire 4 years of medical school. And I can wrap up a medical school nutrition course for you all at home. It's going to be number one, don't eat red meat. Number two, if you're diabetic, don't eat carbs. And number three, cut down on your sodium. I mean, that's what they're just copy and pasting all of these physicians to know,
Yeah.
which there's nuances to. Again, there's good points and good recommendations to that. But, all of these medical students, they get trained like that, and then they really don't have an education in nutrition. And then they go on to residency. They do a lifestyle medicine program where they show these very small niche trials of, 40 patients in a trial of, there was this one trial, I forget the name of it, but it was like they took two groups of people. One group stopped smoking and they started doing plant-based diet and they reversed their coronary artery disease. And it's like, wow, that's really great. But they're pushing the plant-based as doing the reversing of the coronary artery disease, when in reality, it's likely that they stopped smoking that really helped reverse that. So it's just interesting. And especially as I get further into this field and further into my medicine training, there's a lot of people who will nitpick different research and nitpick their kind of ideas of what works and what doesn't. But at the end of the day, it's the experience of that physician and it's the experience of what they've had with their patients that works best. And people can sit there and nitpick research, but at the end of the day, we're not in a lab. We're out in the world and we're eating many different things, and you can't control all of these things that they're doing. And again, it's just like, it's interesting to see how big medicine kind of pushes certain things. And again, you talk about education, it's the one thing that's missing. That's why I'm so vocal on social media and want to push out to as many people as possible, because I'm able to educate millions of people every single day just by posting a video instead of just working at one person at a time in the doctor's office. So it's just definitely been interesting.
For sure. So there's always agendas, unfortunately, I feel like in medical school, and that's part of the problem. And to your point, like some of these people, I don't think that every provider, every doctor, every whatever is a bad person. Some people may feel better as an just eating plants, right? Like there are people that I truly believe, yes, they feel better not eating meat, but that's not everyone, right? A majority of people are going to feel better eating, some sort of animal proteins, because our body, we need that, especially as we get older. We need it to build muscle. And so it's just frustrating when anyone has an agenda and pushes it to the fact of like, this is, everyone should do this. Like, I don't think that's the case in general with anyone. I think in medicine, everyone is an N of one, and you have to work with the person that, is in front of you. But I do find it disheartening that we have a lifestyle medicine program that is, kind of forcing upon people a plant-based diet. So, what we need to do is fix education in residency with providers, with patients. But if the people who are fixing that education are pushing things like plant-based diets, we're going to be in trouble. So again, it's frustrating. There definitely needs to be better education. And also, by the time this podcast comes out, the new dietary guidelines may be out as well. I had the privilege of hearing about them last month, and hopefully they're going to be better. I think they're going to be better than what we have. But, my point was to all these people. So I sat in front of these healthcare policymakers who are all excited about these dietary guidelines. And I said, this is great. What is your plan to educate people? And they kind of looked at me like, well, what do you mean? We made guidelines. And I said, okay, how many Americans are going to read those guidelines? How many providers, how many, nurse practitioners, PAs, doctors are going to read your guidelines? And they just kind of looked at me like, well, I'm assuming everyone. Well, you are assuming incorrectly. And so the problem is, even though we make advances in things and we come up with guidelines, and people don't necessarily read them. Maybe one person reads them, makes a video, it's not correct, or nobody reads them, And so the problem is more of an education issue, to your point of like, how do we educate people? How do we educate patients and people to expect more, want more, have better just information around chronic health and gut issues and nutrition? And then how do we put some of this into our training? Like, to your point, less than 24 hours of nutrition training. I have a metabolism degree. I have a board certification in metabolism. I just recertified my boards, and I had one question out of 180 on metabolism. But I am a metabolism board certified provider in the United States. That is alarming, concerning. Like, there's so many issues with that, right? And so most people are going to probably have zero questions about nutrition on their boards, but yet we're supposed to be the people who are telling patients what to do. And this is why I have patients who come to me and say, well, my doctor said I can have Diet Coke because it doesn't have calories. And I'm like, okay,
Yeah,
big disconnect there, right? Like, sure, it doesn't have calories, but let's talk about what it does to your gut. Let's talk about what it does to your cortisol. So it's just, there are so many issues.
yeah, 100%. And unfortunately, we as a society, I think right now in 2025, everything's just kind of like polarized. Everyone's thoughts, some people are really liking what's going on in the world of healthcare. Some people are really
Mhm.
pushing back against it. But, at the end of the day, I was just talking to someone about this the other day. We were probably doing lobotomies in like 1960, 1970, to be quite honest. Like, it's crazy to think that we're coming from there to now, only a few years later. And, there's all these new recommendations, all these new studies coming out, and I just see so much pushback. I've never seen as much pushback as I've seen today with all these new studies coming out. And it's always good to, when something comes and news comes out, to research it on your own. But it's just unfortunate that we're in this weird kind of polarized society where people either really like what's going on or they really don't want to see their doctor. They don't want to follow these guidelines. But yeah, back to your point, education's what's lacking. And that's the reason why I want to push it so hard on residency programs. That's why I want to push it so hard on my patients. Education is free, especially in the age of social media. So being able to articulate these different guidelines that are actually going to have people open up their eyes to say, oh, maybe this is a good idea for me, will be helpful. But again, when you look at like the food pyramid from, the 1980s, and how that's kind of progressed from now, this entire nutrition and dietary recommendations has really been flawed for a long time. And I think that there's going to be some new things coming out, and I'm praying that it really does have an impact on people, because at the end of the day, we're sick. Like, the American population is sick with our obesity rates going about 50%. I think they've kind of capped off with GLPs, and we can talk about GLPs a little bit too, because that's a big thing that I'm seeing. But especially with, pre-diabetes at around 38%, like, people are really sick, and it's unfortunate that the majority of it is really being caused from food. And doctors will tell you eat less and move more. And for me, it's like, I think the move more is great, but it's like, you don't have to eat less. I want you eating more fiber. I want you eating more protein, because those two macronutrients really increase GLP naturally. They can actually make you feel fuller for longer. I want you getting olive oil in your system every day. There was research out, 30,000 patients over a 30-year study reduced your risk of developing Alzheimer's dementia by about 28% by just getting that monounsaturated fat in your system, reducing your processed carbohydrates. There was a big push from fats into carbs, and what happened is everyone started getting insulin resistant, and it started a plethora of chronic conditions. And people really just don't realize it. If the average American is eating 250 to 300 grams of carbs a day, there's a lot of education that needs to be done.
Yeah, 100%. Like, so much education, just lots of issues. Do you think that the world is so polarized too because it is not only easier to consume information, but easier to get information? And by that, I mean, if you scroll on Instagram or Facebook, you can get 20 people talking about nutrition and they all have different opinions. And it is difficult to know what somebody's credentials are and or if they even know what they're talking about, right? So I think that part of the issue too is like, if you're listening to this episode right now, driving home from work as an accountant, if you want to go home and make a video on Instagram and say that you're a doctor and say that eating plants is great and say whatever you want to say, you can do that. And not that I want censorship in what people can say, but maybe there should be some sort of like credential checking from Instagram or Facebook, or where you can't say you're a doctor unless you're a doctor or you're a medical doctor. There are some just different ways that you can tell, hey, does this person have the credentials to be saying what they're saying? Does that make sense?
100%. And also, like, in regards to, this is off topic, but at church, we talk about the word of God, and we read from the Bible. And our pastor always says, just because you find it on YouTube doesn't mean it's the right word, because these algorithms can really they will align to whatever you think. They will align to, if you're someone who's stuck in this, like, I want to eat high carbs and high fat and not eat any protein because protein's bad for you. Like, your algorithm will go to that. And
Mhm.
at the end of the day, it comes down to finding people who are trustworthy in the space and coming down to people who actually do the research. But it is difficult. And I often go onto people's profiles. It'll say Dr. So and so, and I'm sitting there trying to find the credentials, and they're not really a doctor. Maybe they're like maybe they're a physical therapist, but they're giving, social media on nutrition, or maybe they're a chiropractor and they're giving, information on like blood pressure or thyroid issues or hormones. And it's like, yes, you can go and niche down in whatever you want, but it is difficult because we really are, it's an open playing field for anyone and anything. And it can definitely be confusing as someone, if you have no medical background, it can be definitely confusing. And it's also hard too. And that's why I really try to push my social media the way that I do and teaching people how to eat right is because a lot of people, we go to medical school, we learn all these fancy words, all of this medical literature, we're able to learn. But a lot of people aren't going to sit and read that research, and it's not going to make a lot of sense. What's a p value? What's they're not going to understand a lot of these different things. But finding trustworthy people in the space and being able to do podcasts like this where you're actually able to have good communication and talk to people about the issues in healthcare, I think that's what's going to be most helpful, and just finding that trustworthy provider. And I think you're definitely one of them, representing Oklahoma City. And you've been
Oh,
expanding quite a bit too, haven't you?
yeah, we have a license in 43 states now.
Wow, congrats.
Yeah. So is residency everything that you thought it was going to be? Like, I know we talked before this and you feel very blessed to be in the residency program that you're in. I'll let you kind of tell people how that's going. It's not a typical residency program, but do you feel like residency and the education you've gotten so far is where it needs to be in this country? Do you feel like there's anything lacking? And do you feel like when you talk to other of your friends that have gone to, programs in the last 6 months, do you feel like traditional medicine residency and education is where it should be to help prevent, people from getting chronically ill, or do we still have a lot of work to do? Because I haven't been in residency since 2014. So it's been a while, 12 years. So you tell
Gotcha.
me, how is it?
Yeah, I mean, so I love my residency again. It's a very small program. There's only 12 residents in the entire class. The one thing that I just thought of is none of my attendings, none of them are overweight, which is really interesting to me,
That
which
is
is a
interesting.
good sign. It's a weird thought, but they're very good. And to be honest, like, so we run a kind of different program when it comes to how we kind of are with our patients. So I'm not sure how all like health insurances work, but with ours it's like I think it's called a DPC. I think that's the style of kind of, you know,
Yep.
patient program that we have.
Direct primary care.
Yeah, so we really try to not get our patients into the hospital. Okay, that's the biggest thing. We really try to get them into our family practice as much as possible, as much as they need to make sure that we're not admitting them into hospital. Because every time you have a hospital admit, you are paying thousands of dollars. You're paying $1,000 for the bed, $1,000 for the stay. You're paying $800 for a Tylenol. Like, it's insane. Everything's marked up in the hospital. So with us in our clinic, we are very proactive with our patients, which I think is something that I've never experienced before. So we try to get our patients in. If they got to come in every month, we'll see them every month. They got to come in every 6 months, so be it. We're always up to date with labs. We're always up to date with communication. And I just think that our program specifically, I mean, we're known to be the best in our area for a reason. We've been here for 20 plus years and we take great care of our community, but it's because we have this proactive kind of push on our patients. We do not want people going to the hospital. We don't want readmits. We don't want people getting sick. And that's something that's totally different versus any other residency that I interviewed at that really gives it kind of a little bit of a different flavor. Plus, what's really nice about my residency is the fact that they understand that I do social media. They understand that I run a business. They understand that I have a lot of education and a lot of background in nutrition, and they don't dampen me and they don't try to like hold me down in my education and how I treat patients. And I was just telling you before the podcast, like I take every diabetic patient that I can from that clinic because I can give them all great diabetes education, anything with hormones, anything with gut health. I want all of those patients because I can actually sit down and they give me the time to actually see patients. Now, I'm only in my intern year, so they give me a little bit extra time with every patient, but I use all of that time to the best of my ability. I write out recipes. I write out little like tip sheets for them. I'm actually working on getting the entire office a tip sheet that's going to go over things like what macronutrients are, what a calorie deficit is, why fiber is important, things like exercise, and then some recipes so that every patient can walk out with a simple tip sheet that gives them kind of step by step what they should be doing. But yeah, in regards to the residency, I mean, I was telling you before, I was blessed more than abundantly. There's no 24 hours, there's no overnights, there's very little call for me. So they really care about our wellness and they really care about us as residents. And I have nothing but good, great, amazing things to say about my residency. And they've really treated me so well, especially with all the stuff that I was doing on the back end. Because I remember when I was in medical school, a lot of these professors, a lot of my advisors were telling me that if I was going to continue doing social media, I would never get into a residency program. And no one would ever want a student that was into nutrition or had a cookbook or all these things. And I've been nothing but blessed. And to be honest, when I interviewed at this residency program, the only thing that I talked about was gut health. Literally, that's all I talked about. I didn't talk about anything but gut health. I talked about the gut microbiome, about fiber, about different bacteria, different stool studies, and I think it kind of threw them off, to be honest. I don't know, but that's literally what I did, and it worked out so well. And I'm telling you, I'm just so blessed to be where I'm at.
That's amazing. So it sounds like you have a really good program. Not many programs are like that. I think the interesting thing about that too is you have a program that is invested in patients and wanting to keep them out of the hospital, which is really good. So my question is, do you go to the hospital and do rotations? Like, do you see people in the hospital if they end up there?
Yeah, so I'm actually on an inpatient medicine rotation right now. So I've been on here for the past 3.5 weeks, just kind of managing patients anywhere from heart failure exacerbations, pneumonia. We've had some brain abscesses. We had a Miller-Fisher variant of Guillain-Barré. We've had some really interesting pathology. But yes, I'm on inpatient right now.
Are these the same attendings that you have in your clinical setting? Like these are the same people, or is this a different group of people that teach you at the hospital?
Nope. So they're the same attendings at the family medicine practice. So we only take family medicine patients when I'm on inpatient with the family medicine rotation. I do 1 month of regular inpatient where I'm just taking all admits in the hospital. But what's really nice about our program is like if you are a family medicine patient and you come to our hospital, we will take that care on, and then we have a background on all of our patients, and that's why we have better outcomes.
Right.
It's really interesting.
So is this hospital that you do this, is this associated with or owned by the DPC group, or is it just a community hospital that you're doing this at?
Just a community hospital, so it's not like they're just a program within the hospital that supplies other services, but we also use that hospital for all of our other rotations.
And so that hospital is also staffed by physicians who probably work just for the hospital system and don't do a lot with the residents, or they still do stuff with the residents. It's just not as much.
Yeah, so there's a full inpatient medicine team. There's an IM program there that all of those physicians are, they work for that hospital system. But a lot of like the specialists, cardiology, nephrology, pulmonology, there are a lot of outpatient kind of almost like contracted doctors that come in there. And I don't know, the way that the hospital is set up, I love it because I think that it really does just give such a proactive approach to this community. But yeah, in regards to everything from the clinic to the hospital, I have full continuity of patients. So it's really cool for me. And I think that's why my education's been so good, because I can see them from inpatient and then go follow them outpatient as well.
Well, the interesting thing I was thinking about is like, if we're going to fix education in this country, a lot of residency programs, mine is one of them, was centered in a hospital that was underserved in a big city, right? So like Kansas City, et cetera. In those places, there's not a lot of this direct primary care like you're speaking of. There was so many patients to take care of that although you had really sick people and maybe wanted to see them every 2 weeks, you couldn't because your next availability was 3 months away, which is what it's like in the real world under this insurance model that we have in healthcare, which is why our healthcare is so broken. You have a very different model that you are practicing under, which is almost, well, it's called direct primary care. It's like some people pay a lot of times to be in this, to be a patient, but then the doctors that are taking care of these patients don't have as many patients so that you are able to take good care of them. It can be a little more cost prohibitive up front, meaning it costs a little bit more, but you make it up in leaps and bounds in the back end because people aren't in the hospital and they're not as sick and et cetera. And so what we need are things like this that we can then show to legislators and say, hey, this residency program is actually working really well. People are, the residents are happy. They're not overworked. They're mentally, good. They're still learning how they're supposed to be learning, and patients are actually benefiting from this. And then we need to figure out how to duplicate that thousands of times throughout the country instead of having these facilities, and maybe it's different from when I was a resident, but probably not, that you serve under, underserved people. There's too many people to be seen. There's always, it's too much. And so this is how healthcare needs to change. And it's good that you are in a community like this. The other unfortunate thing is a lot of times medicine is a big business. And I think I told you this when you were here, if your community relies on the hospital's income, then they're going to want the people to be sick and they're going to want them coming to the hospital, right? But if the community has your back and they say, no, we don't want people in the hospital, we want them to get better, then it's a whole shift. And it's not just one thing. Like, this is why there's so many things wrong with healthcare. We have to get everyone on the same page of like, hey, we don't want to utilize an ER for primary care. We don't want people to be in the hospital. We want empty beds because it is expensive, and we want to take care of these people in a clinical setting. And so it sounds like you found an amazing place. Nothing like where I went to residency, but it would be interesting to see if somehow you could replicate that. And there may be other programs like that, but I think for the most part, they're going to be like that internal medicine program you were talking about, based out of a community hospital, seeing too many patients, et cetera, et cetera.
Yeah.
Does that make sense?
Absolutely. But yeah, I think that the majority of my colleagues that I saw in medical school, they're in programs that they're being overworked like crazy. And it's just, unfortunately, that's just how it is. And definitely we're understaffed. All doctors are really understaffed, and it really drives a lot of poor outcomes at the end of the day. But yeah, it's definitely a unique residency in that way.
Why do you say you're understaffed? How are you understaffed? Like, you don't have enough time to spend with every patient. There's too many patients to take care of. Like, explain that.
I think for us, I don't think we're necessarily understaffed. I just think that other residency programs are. And I really think that in our country, we lack a primary care. That's kind of the biggest thing. It's like, if we had more primary care physicians that were actually paid better, I think that our outcomes would be so much better. But as a medical student, the average medical student's $250,000 to $300,000 in debt. And, if you're going to work for, a regular primary care, you're going to be working, maybe $100 to $200,000 a year. And those loans, they continue to add up. And that's why so many people are pushed into specialties. They want to make more money. And there's absolutely a business to medicine, but in regards to family medicine, like, there is a big need for people to go see their doctor. And again, going back to what we were talking about with the polarity of our society, it's like, not enough people go see their doctors, not enough people go get their labs, not enough people go get annual checkups. And these things are important. Like, we need people to be kind of proactive themselves. But again, it really all ties back to that education portion that we're just lacking on. And I think if more people realize that if we could maybe nip some things in the bud early on, that they would really be saving a lot more money in the long run in regards to chronic conditions.
So I'm gonna talk a little bit about something you just said. You said a lot of patients don't go see their doctors like they're supposed to. They don't get their labs. A lot of those patients, what I have found though, and you'll see this as you go further into medicine, is they don't do it because the system has failed them so many times. Meaning, they used to go to their doctor every 3 months, every 6 months, and get labs. And then they got a $3,000 bill. And then they couldn't get the bill fixed. And then, they saw their doctor again, and now their doctor's become really busy. And so instead of spending 30 minutes with them, they're seeing 5 minutes with them. And instead of listening to them and trying to help them and educate them, they're giving a prescription to them, which they don't want to take, and kicking them out the door. And so a lot of people, unfortunately, in the healthcare system, in the traditional healthcare, have maybe tried to do their part, not everyone, but a lot of them, but the system has not made it conducive for primary care doctors to do their part, right? You can't fix people and fix chronic illness by forcing them to see more people and giving you the same amount of time and the same pay or less. And so our entire system is completely broken. I think it's going to have to be completely revamped or it's going to go bankrupt. That's a whole nother conversation. But to your point, yes, I mean, in order to fix chronic illness, there has to be education, there has to be resources, there has to be time. And I understand not wanting to go to school and I was $500,000 in debt whenever I got out of school. And I was $498,000 in debt. If you go somewhere and make $100,000 a year, you're going to be in debt for 30 years. And not saying that we're all perfect, but being a doctor is hard work. It's mentally hard, it's physically hard, it's emotionally hard, right? And a lot of people have the privilege of going to work and then going home and leaving their work at work. I would say that 99.9% of doctors, if they did it for the right reason, are empathetic, don't go home and leave it at home, or don't go home and leave their work at work, right? We take it home with us because we're always thinking like, how do we help that patient? Oh, this is bothering me. Oh, like I wake up in the middle of the night all the time mad about stuff. Like, how do I fix this? How do I fix this policy? And so it's hard work. It's blessed work, very privileged to do it, but it's hard work. And so the whole system has to be redone. And you'll see even more of this. Like, we should probably have one of these interviews once a year. You'll see. We'll see how long it takes Johnny to really like turn. But yeah, but I'm glad you got a good program, right? Like, I'm glad you got a good program. But it's interesting to hear how some of your other friends are overworked, probably aren't respected like you're respected, don't really get proper training, definitely don't get nutritional training, and then are supposed to go out into the world and make people better. And it's a failing model.
Yeah, and I've seen both sides of it too. Like being at this program is definitely it's a zebra program, but I've also
Mhm.
trained under family medicine residents who work for large corporations that they have to see, 25, 30 patients. They have to,
Mhm.
or else they do not get paid. Also,
Mhm.
if your numbers are not up, they'll hold your paycheck. If the entire system in regards to that, the corporate side of medicine, it's bad. It doesn't work for the patient, and it really doesn't work for the doctor either. I think people also have like these, thoughts with doctors that we're out to get people, but at the end of the day, like I've worked with family medicine doctors who can only have 5 minutes per patient because if one patient takes an extra 20 minutes on top of what their schedule is, then they're 2 hours behind by the end of the day. It's unfortunate, but that person coming in for their chronic disease checkup, it's only going to be a 5 minute conversation, and then they're going to take every acute, just prescribe antibiotics, whatever it is, just to get through the day. And it is unfortunate, and it doesn't work for the patient. It doesn't really work for the
Mhm.
doctor. There's a whole system that's really not working for either of us, and I don't really know who makes out on the top of it. Probably the administrators and the CEOs, to be quite honest with you, because they're the ones they're making the most money anyways, and they're not really doing. I mean, I don't really know what CEOs do, but it's a system based issue, and that's at the end of the day, that's the problem.
And the insurance companies, they make all the money. That is public knowledge. Look up how much Blue Cross Blue Shield, Aetna, United Healthcare made last year. The insurance companies make all the money. Now, you're right. The CEOs of hospitals and people like that do as well. And that's the problem. Like, it really is, and I can say this because I confidently have been through all of it, right? I went through residency at an inner city hospital. I went to fellowship at a place that wasn't, I mean, it was in Oklahoma City at OU Medical. I wouldn't call it as inner city and, as where I did my residency, but again, had some issues, wasn't as bad. I worked for Mercy Healthcare, which was a big corporate hospital. And then I've been on my own. Well, I worked with a partner, and then I've really been on my own, and I've been through it all. I've been in through the insurance, I've fought with insurance. Insurance just owed me a lot of money. They still do, probably will never get it. But it's just a frustrating thing for everyone involved, right? Other than the insurance company, other than the people who are holding your money. And so I do hope that there's a lot of healthcare reform that's going to come out of this, but it is interesting to get your perspective. I just wanted to pick your brain since you're like 6 months in, and I would love to pick your brain again in a year, but it's probably not even going to be like, the worst of the worst because you got blessed to go to a facility that sounds like it's a great place. So I'm happy for you. I also wanted to talk to you, and we talked about this too. I know a lady who is just amazing, Dr. Terry Denai, and I kind of put this bird in her ear. She's got a lot going on with healthcare reform, healthcare policy, hormones, gut health, but maybe her and I are going to work on like a CME board certified like gut program for providers too, which would be awesome. And if we do that, maybe we can pull you in to do some nutrition stuff. But just anything like this is what we need to help educate people for sure.
Yeah, and absolutely. I mean, a gut health program would be amazing. It would be quite the mountain to push people to, I think, believe in it.
Mhm.
But it's really amazing, when you start implementing these small things like fermented foods and fiber and all these things that we talk about every day. But yeah, we just need more reform. At the end of the day, we need more reform. And I get it with the insurance companies. I mean, I have patients who need scans and tests and all these labs done who get denied all the time. It's frustrating for us as doctors. It's frustrating for patients, but that's why, honestly, by the time that I'm done, I want to go private. I want to have my own clinic and just kind of do my own thing with people. And what's interesting is like one of my other co-residents, he's doing a DPC as well, and he was showing me some of the prices for some labs, labs in general.
Mhm.
It's pretty interesting to see, the detailed receipt of some of these things that we're paying for and the markups that people have,
Mhm.
even with these insurance companies. It's honestly unbelievable.
Yeah, and I don't know if you remember when you came with us, but we offer cash pay labs for patients, and we've even been able to go down on the price since you were here because we work with companies. But I can check your entire thyroid panel, your TSH, your T3, your T4 for $25. That includes a draw fee, all of it, $25. You get a order or a bill from your insurance company for a TSH. It's going to be at least $60 if you're lucky. A T3, can be 100, 110. And it's like, how is this legal or possible? Because you could just pay cash for it and it's $25. So there are so many issues, unfortunately, in healthcare, which I don't want to get down that rabbit hole. But yeah, there's a lot of reform that needs to happen. What I do want to ask you though, last year, I think we kind of talked about it when you were on the podcast. You had a weight loss cookbook and you've come out with, I think is this version 2 of the weight loss cookbook recently?
To be honest, it's version 4, but I didn't want to change the title because I wanted it to stay the same because it is an Amazon bestseller right now. I
Yes,
wanted it to stay that way, and it's absolutely been changing thousands of people's lives. It's a
yes,
beautiful book,
it
brand new
is.
cover, brand
But you
new.
know what? It says doctor this time. So last time it was Johnny Haddock. I should have brought the other one up here. Now it's Dr. Johnny Haddock, but you have the old one, but it's 2.0, the revised edition. So why did you come out with the revised one? Yep, there it is, the blue one. Were you so there is definitely new stuff in here, y'all. So I love this. He has a whole, in the beginning, he has a whole education system. And I was looking through and I almost cried. There's these calorie, how to master calorie and different things about how you have metabolism. He has a whole gut section in here, which I was like, this is amazing. A whole section about gut and fiber and nutrition. And so he really does try to educate you and he does a really good job. So you look at this. This should have been dedicated to modern endocrine. Gut
100%.
health, whole section in his cookbook, which made me so happy. He came out with a probiotic recently. He's all on board. These are all things that make sense. The hunger fullness cycle, your gut, the hidden keys to weight loss and health. And he tries to explain to you what's inside the gut, your tight junctions, your mucus layer, all these things. So this is amazing. Fiber, he has great pictures. Look at this, you guys. If I had a book, this would be my book. So what was the point of this new book? Was it just adding some education? Was it also that you wanted to add your name doctor? What was the point of this?
Yeah, so number one, it's the first cookbook that I ever made during residency. So I'll be able to, if I die, I'll be able to say, this was the book that I made during residency. It'll always be there. But yeah, no, I wanted to expand on it a little bit more because since even the last time that I saw you was around the time that I launched the other cookbook, and I put the gluten and lactose free stuff in there for you too.
Yay! Some of my
Um,
favorites.
But yeah, so at the end of the day, I can give people recipes. I can write out recipes all day long. It's very easy for me. The hardest thing, again, and this is really the entire topic of this podcast, is education. So I want to go in and give people, I want to break down research, put it into easy, understandable, digestible knowledge so that people actually understand what they're doing and why they're doing it. Like explaining the hunger physiology and the hormones that are involved that cause you to be hungry, that cause you to be full. To help explain like the basis of gut health, what your gut is, the anatomy of your gut, the one cell layer of gut with the mucus on top and the bacteria, so that you actually get the education and then you get the recipes on top of it. And one thing that you wanted on the old cookbook was fiber on all those macros. So every one of those macros has fiber now.
Yay.
So that's a big thing too. But now there's over 100 pages of protocols before you even get into the recipes. There's over 500 recipes in that. There's also gluten and lactose free recipes. I tell every one of my diabetic patients, if you're diabetic, get the cookbook. Your doctor will thank you because I love reversing people's A1Cs. It's my favorite thing to do in medicine. I just like getting to the physiology of things, and that's the cool thing. There's a lot of people out there who have amazing cookbooks and a lot of great recipes. I'm just blessed to be able to be someone who can make good recipes and be a doctor that can really fill in a lot of those education gaps. So a lot of people ask me for one-on-one stuff. Right now with the crazy residency going on, it's just best that you get a cookbook that's really an extension of me and my thoughts and the recipes that you need and workouts. So it's kind of your all-in-one book, your all-in-one resource. Bring that thing to the grocery store, grocery shop with it. And it's also meant to be affordable and accessible. You can actually find every single ingredient right at Walmart, which is awesome. And yeah, I just wanted to make something that was accessible, easy, simple, and delicious. That's kind of the biggest portion of it.
So I love that. So you added fiber, which is so important. You have really good education in the front of it. And it is education that like, I feel like most people can understand. Although you are a doctor, right? And I am a doctor. Other people can understand this too. And to your point, this is kind of like a free resource. Like you've got a whole insulin resistance, the root cause of prediabetes and type 2 diabetes in here. That is like amazing. Like, and you do, too much refined carbs leads to insulin resistance and insulin levels rise and then your pancreas can't keep up. I mean, you do a great job of just educating people, which I love, and making it so simple. You have your QR codes in here. And so I think that this is just a wealth of knowledge for people. I mean, there's almost 100 pages here of just, you have a PCOS section, almost 100 pages of just like education, which I absolutely love and adore. And this is all new. And then yes, your fiber. So I think, if you're listening to this, this is available on Johnny's website for $49, which we will put in the show note. It is an Amazon bestseller. It's $100 on Amazon. But you should go support him either way. This would be a phenomenal Christmas present. Again, 100 pages of just really good education all in one place. And so I'm glad you made this because you're right. You could take this to the grocery store. You could go to Walmart. You can get the ingredients to make meals. You did have a whole section of there, some of my favorite things too, gluten-free, dairy-free. And so this is just accessible for anyone, right?
Absolutely, absolutely. And yeah, I just try to put as much education there too. And what's cool about the QR codes, there's actually research articles if you wanted to get more in depth and learn the actual research behind it and what kind of, or I guess where my thoughts were in different resource articles, you can go and look at it. So I really try to make it, easy to understand, but if you want to get more into detail with the actual research and some of the, evidence bases that are in that book, you also have options for that too. And yeah, I'm so proud of this book. This is by far my best piece of work. The most amount of recipes, the most amount of workouts, the most amount of education. And I really just try to take everything that I've been helping people since medical school and just help them understand, whether it's PCOS, whether it's menopause, and just giving you a basic idea of like maybe what your hormones are doing, maybe what your body's doing throughout these times, and just giving you guys a little bit more of strategy and structure in regards to these chronic conditions, because a lot of people have them. The insulin resistance and type 2 diabetes, that's a major portion of the book that's really going to go into a lot of inflammation. Insulin resistance and gut health is very much correlated to one another. The gut health tip sheet is very expanded. There's a lot of information on gut health there. I know that you appreciate that. But yeah, it's really just meant to teach you. I call it a nutrition textbook. It's a nutrition cookbook and a textbook. And I honestly wish that medical schools would teach a lot of the stuff in that book, because there's a lot of good stuff in there, and there's a lot of practical lifestyle habits that are also in that book, because there's macro tracking in there, there's a daily checklist in there, there's a free macro calculator in there. So I really try to put every single thought of what people could be missing and why they're not hitting those results or hitting those goals, and put them all in one place so that you have them with the recipes to support your gut, your hormones, your insulin resistance, raising your GLP, because that's my big thing. That's why I focus on high protein and high fiber, to naturally raise people's GLP. And that's why I'm so good at helping people lose weight and actually having them stick to it for a long time, for the rest of their life, because I actually work on the hormonal level with these recipes that you don't even necessarily know is happening on the back end. But I'm making you feel fuller because I'm messing with your hormones, and I'm trying to kind of optimize things with your gut. So there's a lot of science into it. There's a lot of evidence into it, and I'd love for you guys to check it out. But I'm very, very proud of that. And I'm happy that you have a copy yourself.
I am like, my heart is so happy because everything that you said is so true. And like, if we could just get every person that goes to medical school and becoming a provider or nurse practitioner school to understand half of what you do, the world would be a very different place, right? So I'm so excited that you put this together. This is a great resource. Again, we'll put the links in the show note. This would be a phenomenal Christmas present for anyone. If you are a resident, fellow, anyone going through any sort of training, you should get this book. The first 100 pages will blow your mind and teach you so many things. And I'm just super, super excited for, what year are you going to be done with school? 2028? For 2028, whenever you're going to go out into the world and just, I mean, you're already educating so many people, but you're going to get to join the force of like changing the trajectory of thousands and thousands, if not maybe millions of lives. And it's just the coolest feeling. And I'm so proud of you. Super excited. So yeah, I love the book. I'm so glad you sent me the book. The only thing I could say is, man, I wish you would have signed it like you did your other ones. Cause I'm
I
just
know,
like,
I'll come out and sign it. Hopefully it's
that,
I'll come
yeah.
out and sign
We're
it.
going to make Johnny come sign the book.
Just no tornadoes, no tornadoes.
No, yeah, the last time he was here, y'all, in October, we had a tornado in Oklahoma, and he didn't love that so much. I don't blame him. So, or maybe I'll bring it with me to Florida, and you can come sign it there. But I appreciate you coming on and chatting with everyone and just kind of giving us an update. We'll do it again next year. I want to see how things progress. I want to end by asking you the 3 questions I asked you last year to see if you've changed your mind. So the first one was, what is one food that's most beneficial and why?
So I knew this question was coming, and I've thought a lot about it. It's a hard one for me. But to be honest, I don't know what I said last time. I think I said eggs, but I think I'm changing it to berries right now. I think that berries are probably by far one of the most beneficial foods that anyone can have, especially blackberries, raspberries, blueberries. They're going to pack a lot of fiber, which is very helpful, because 1 cup of raspberries has about 10 grams of fiber, 8 to 10 grams of fiber. And adding any sort of berry onto yogurt is just a powerful, powerful combination. I do lactose-free yogurt, Fage, F-A-G-E, with blueberries on top pretty much every day. But yeah, I love berries. I love my olive oil. I know I'm giving out too many different answers, but olive oil, such an amazing monounsaturated fat, amazing for inflammation, amazing for heart health, amazing for brain health. So yeah, I'll stick with berries, but the list goes on.
Yes, berries are so wonderful. And that's one of my favorite yogurts too. So that's a life hack for sure. Like using berries, like increasing your fiber, putting it on protein. I love it. What is one thing that anyone listening to this podcast right now can do that's 100% free for their health?
There's so many different things. Number 1, you can just ponder at the sun when you wake up in the morning. It's really going to help align with your hormones. Your entire body is based off a circadian rhythm with the sun and with the moon, so your hormones are really based on that. I go into a lot of detail with that with the book, but just looking at the sun, very, very important. Number 2, hydrating. We don't drink enough water. I see people's creatinines elevated every single day. It drives me crazy. Got to drink enough water. Even if you're mildly dehydrated, your metabolism will slow. Stop drinking soda. That's a big thing too. Any sort of artificial stuff, you're wasting money on it. What else is free?
You just needed one, so you nailed it.
I
Look
mean,
at the light, drink water. And then what is one thing that you wish you would have known about your health 20 years ago? Well, you're not even that old. 15 years ago? What is one thing you wish you would have known about your health when you were a teenager that you would have done differently?
fiber is good, and again, as someone that tried carnivore, because so when I came to Oklahoma, I had a lot of skin issues, and I was really doing a lot of dairy and a lot of gluten. So it worked out. My wife has celiac disease, so I'm on the gluten-free train for the for the most part. But fiber is so important, and it's important for a multitude of reasons. But I always tell my patients, the fancy word for fiber is prebiotic. When you take a prebiotic plus a probiotic or a living bacteria in your gut, you create postbiotics, which are called short chain fatty acids like acetate and butyrate. And when you create these postbiotics, it strengthens that gut microbiome. It helps kind of flourish the good bacteria in your gut as well. Fiber also naturally raises GLP, which is going to make you feel fuller for longer. So if you're someone who deals with food noise, lots of cravings, fiber is very helpful. And fiber is very helpful for your mood. And if people ate more fiber, they'd probably be happier. And studies have actually shown that there was one study in particular that took a group of depressed patients. They split them into two. One group had more fiber, the other group was a placebo. The group who had more fiber, their depressive symptoms improved, which is amazing. But it goes back that 90% of your total body serotonin is in your gut. 70% of your immune system's in your gut. If you're not taking care of your gut health, you're going to be sicker, you're going to be more unhappy, and that's why fiber is just it's the way to go. So eat your fiber and be consistent, 30 grams a day at least.
I love it. You're just preaching the modern endocrine gospel. So, um, besides getting your book from Amazon or your website, how can people support you? How can they find you? How can they follow you? What can we do to get more Dr. Johnny Hadac?
Yes, you can follow me at any social media at Dr. Johnny Haddock, Facebook, Instagram. I'm going to be doing some more YouTubes here. My book is out. Grab it for a Christmas present. It's a great investment in yourself. And I always tell people, I know a $50 cookbook is crazy, but you're going to save $50 in your first week of meal prepping, so you will make your money back. My Total Weight Loss app is going to be coming out. It will be out at this point, so you can find that on the Apple and the Android store. Total Weight Loss app with workouts, recipes, and tons more information for you. But yeah, just grab the book, grab the app, and also come join a community challenge. So in the book, there's actually a QR code for a community that's free. There's a free hour course in that community as well. But I'm doing a 30-day challenge on January 1st. If you guys want to come join, get some more lifestyle, get some more habit formed, I will kind of coach you guys through 30 days, January 1st. So once you have the book, you'll have access to the community. Come do a 30-day challenge. It'll be a great time, great support, thousands of people in that community. And we do a lot of giveaways, and we just try to keep it really active and really positive. So I appreciate you all for your support. But yeah, find me on socials, grab the book, grab the app, all of that.
Awesome. So we'll drop all that in the show notes. You keep being an amazing, awesome beacon of light in the medicine community and get through residency. Let me know if you need anything, and I'm going to make you sign this book at some point.
I'll do that for you. I appreciate everything, and look what you've turned me into. You've turned me into someone who cares about gut health and all these different things. You've taught me a lot, and I am very appreciative of you too. Thanks for taking a random third year from New York to come visit you in Oklahoma. It's quite an experience.
I bet it was. Johnny never wants to come back to Oklahoma, y'all. Okay, well, so good chatting with you.
Absolutely. Thank you.
So I hope you enjoyed that episode. I loved catching up with Dr. Johnny. He's just such a light and makes me so happy about hopefully the trajectory of healthcare and providers that are going to be thinking differently and wanting more and expecting to learn more functional things as time goes on. So if you enjoyed this podcast, please share it with anyone that you love. Please also consider getting his cookbook as Christmas presents or as gifts for anyone. Again, great educational information in there. If you liked this episode, leave us a review, like it, let us know wherever you're watching this. Also, remember that Modern Endocrine is licensed in 43 states. We do virtual visits. We also have a clinic in Oklahoma City. We are happy to help you with anything that we talked about: hormone metabolism, gut health, thyroid optimization, longevity, peptides, whatever you need. We are here. And so make sure that you check that out as well. Join us next week for another episode of Hormones, Metabolism, and You. And also, I don't think I'm going to be speaking to you before Christmas. So please have a wonderful, Merry Christmas. Spend time with your family. Don't let all the chaos and hustle bustle take away from the point of the day, and just love and live and be happy.